Hey everyone, welcome to ToniTime, where solutions are just a discussion away. I want to start off this session, first of all, acknowledging those who have been negatively impacted by Hurricane Helene. I know there's devastation about an hour from me in the Asheville area. We ourselves were without power only 4 days, which is minimal compared to the others. So my thoughts and prayers are with those who have been devastated by this hurricane. Now, today on ToniTime, we're going to lean into one of the new HCAHPS questions starting January 2025. And this is focused on how often were you able to get the rest that you needed? So it should be interesting conversation. I'm Toni Land, founder and chief experience officer for Landing Exceptional Experiences and your host of ToniTime. So I think most of us know that there's been a question on the HCAHPS survey for a number of years that talks about how often was the area around your room quiet at night. Well, this particular question asks, it's a new question, how often were you able to get the rest that you needed? Now, I've heard some rumblings out there, and I've talked to actually several healthcare organizations really exploring how do we present this question to our staff and our team members? Some have subgroups that are working on behaviors that can impact this measure. Some have even talked about scripting to help patients and families know that they will be interrupted in order to receive care. So I thought it'd be a good time to explore this conversation on ToniTime. So I'm going to tell you, first of all, I say connect to the how. First of all, let your team members know how this question got added to the HCAHPS survey. I think I want to dispel that myth that, CMS or the powers that be added this question when really there was a process around it. There were truly patients and family members at the table. It was open for public comment. It was also intentionally sent out to the AMA, the AHA, the ANA. You've got Barrel Institute, you've got Leapfrog, and other national patient advocacy support groups out there that chimed in and offered feedback on the questions that were proposed to be removed and added to the survey. So I think it's important, and it helps shape the thinking, start shaping the thinking in your team members of how this question came to be on the survey. So first of all, we're connecting to the how. Second of all, we are connecting to the why, kind of like Simon Sinek, always going back to that why. And so I think it's important for the team members to know why this question was important to add. And so we're going to spend a large portion of our time today talking about exactly that. So looking out there and digging into some of the research, it really talks about how important sleep and rest is for everyone, and especially for a healthcare and a patient's recovery process. There are things like your sleep and circadian rhythm, which has many, many functions. But one of the functions is also to help regulate inflammation, to growing new cells for recovery, to rest for your nervous system. And so not just the brain, but everywhere in your body can benefit from sleep. And a lot of this research has been done at the School of Medicine at the University of Pennsylvania, and I will make sure I include the link below. So if we think about it, every patient who is in the hospital, they're not there because they're their healthiest self. They're there because their body is under attack in some way. And so every patient in the hospital has a body that is working to heal itself. Yes, we're administering medications and following different protocols, but the body itself has to cooperate with that medication in order to produce the maximum outcomes there. So we think our body is a collection of cells. These cells are responding to illnesses, surgery, even things like chemotherapy. And we have to have this perfect balance of the inflammatory process or responses so that we have a release of growth hormones to help make new cells for healing. Now, interestingly enough, growth hormones are released during sleep, and that generates new cells in the body, everything from your skin to your intestines to your muscles. And about 90%, I'm going to say that again, about 90% of growth hormones are released when you are sleeping. Now, we just talked about the growth hormones released, generating new cells for healing, inflammatory responses. So you can see some of the significance around why sleep and rest are important. And these are the things that we need to be sharing with our teams. Sleep is also important for managing inflammation when we talk about fighting off infections. So it can also, from some of the research, it talks about it lowering adrenaline levels. It helps lower blood pressure and allow the heart to rest, which, think about some of your patients that have cardiovascular problems, that can be important to the healing process. Sleep also can impact mental health conditions. So mental health can be exacerbated by some sleep disorders. You can experience things like mood, mania, and other factors can be impacted by sleep loss. I love this quote by one of the physicians from the University of Pennsylvania, and he says that a healthy body and a healthy mind requires healthy sleep. So I think that's an interesting and key takeaway for us. How are we as an organization providing healthy sleep in order to facilitate the healing process? Interestingly enough, and actually I don't think surprising once we think about it, that when we experience times where we don't get enough sleep, even when we're not in the hospital, it can take us longer to make decisions. We can experience some mood swings and maybe even some anger, and we're more irritable when we don't get enough sleep. Now, I can really attest to this because I oftentimes will have periods where I don't sleep well. And usually day 2, definitely by day 3, I am irritable, I am on edge, I am snappy. And my husband is like, please, please, please do something, take something, but you, for the sake of me, you got to get some rest. Now, I want you to connect that to some of the workplace violence that we've talked about in previous videos, and you'll see the link below. Some of the workplace violence, with the majority of the workplace violence, almost 80%, being verbal violence. Now, think about people who are already, their bodies are under attack. They're not getting enough sleep or rest. That irritability and being on edge could contribute to some of that workplace violence. So, even bringing that into the picture. So when we think about this uninterrupted sleep or limited sleep, that the body is not healing maybe as quickly as it could be, this could lead to longer lengths of stay in the hospital, negative patient experiences, and ultimately poor health outcomes. So there's an interesting body of work out there, and it is called comfort-based nursing practice. And so it's really to help this patient attain as complete as possible recovery from their illness in a comfortable hospital environment. It talks about some physical comfort and things we can do. And of course, for specific patients, knowing that it won't apply to maybe some of those who are critically ill or more immobile patients, but for the ones who aren't, how are we trying to create this comfortable hospital environment that will promote the healing of the body? And so they talk about 5 different things: helping patients with their personal hygiene, maintaining a quiet and comfortable environment to rest and sleep, meeting their nutritional needs, encouraging visits or stays of close family members. So thinking about those care partners and support partners, even pet therapy when appropriate for the patients, and then providing the family and those support ones some time without distraction, without nursing and tech, disturbance. So a very interesting body of work. And I will tell you, it took me back to my nursing school days. So there's something to be said from some of the old school practices, and how do we take those old school practices and make them relevant for the world that we live in today, and the nursing and caregiver world that we live in today. But during my nursing school days, we were actually taught PM care. And it was because we wanted to put these patients in a position to be as restful as possible during the night, because we knew that rest was important to the healing process. So we were taught certain time of night. I think it was usually around 8 o'clock, maybe it was 9 o'clock. But we would go around, we would offer a warm washcloth for them to wash their face and wipe their hands off. We would offer to help them brush their teeth if they needed assistance with that, or if they had dentures and the dentures needed to come out, we would offer that assistance. This was part of getting them ready for PM care for their, bedtime. And we even offered a quick massage. We would put lotion on our hands and we would massage their backs. Here again, getting them ready for a restful, peaceful sleep. Now, this wasn't long and every patient didn't want it, but that was what we offered because we recognized the importance of rest to the healing process. So it definitely took me back there to nursing school. And so, excuse me, another thing to explore is, we've talked about the how, we've talked about the why, what's in it for patients, the team, and the org is number 3. So I think we've discussed what's in it for the patients, that this restful environment will allow them an opportunity to put their body in position to cooperate with the medical regimen to produce the maximum outcomes. Now, what about the team? What could be in this for the team? So 2 things come to mind for me. One is around vital signs. If you've ever worked night shift, you have several patients that have Q4 vital signs that oftentimes we as the nurses, we as the techs feel like, do they really need vital signs at this point in their hospital journey? Do they really need Q4 vital signs? And I think that is a topic of conversation. And there is research out there that shows where they have engaged in some studies in defining low-risk patients and really evaluating if they needed Q4, if the times could be changed to Q6, Q8, or were there blocks during the night that they didn't need them at all. One particular study, they had a standard of every 4 hours, and they recognized that Q4-hour vitals have been around since Florence Nightingale. So definitely we should be evaluating when is it appropriate for specific patients. And so organizations often have it, regardless of patient status or regardless of risk level, Q4-hour vital signs. So in this particular study, they established that in a group of low-risk patients hospitalized, these were hospitalized for minor cardiac procedures, would patient safety be jeopardized if they chose not to do vital signs between 2200 and 0500 or 10 p.m. and 5 a.m.? So that was the goal of this project. Still, your nurses and your techs were rounding every 2 hours at the bedside. And as an outcome of that, 18% of the intervention group still got vitals because the teams were using their critical thinking and recognizing, even though this patient doesn't have Q4 vital signs, they look like they need it based on my assessment. So you had 18% that still got the vitals. And so you still had 80% of that intervention group that did not need to receive Q4 vital signs. Looked at the outcomes of this, not only the number of patients that were did need vitals versus those that did not, but also looking at was safety jeopardized, and they did not see any increase in any type of safety activities. So definitely an opportunity for us to think about, vital signs, and do our team members really need to administer Q4 vital signs on every single patient? And so how do we really prioritize? And I'll go back to their statement: appropriate vitals for the appropriate patients at appropriate intervals. Now, a second thing I want to bring up that I think is beneficial to the team is clustering care. This is not exactly a new concept, but as I was on Reddit, I heard many of the nursing and tech professionals talk about clustering care. And this can be so beneficial when we talk about the efficiency of our staff, so they're able to focus the work they're doing on the right patients at the right times. And so many years ago, I was working with an organization, and we were actually doing some TCAHPS work, transforming care at the bedside, some of the Robert Woods Johnson work. And we were looking at how could we decrease the amount of interruptions for our patients and families, while also benefiting the teams. So nurses and techs would work together on the unit. They would define when they were going in to do certain things. Maybe it was vital signs, so that then I, as the nurse, could tag with the tech. We do everything as much as possible during that one time that we're going in there to wake that patient up anyway. We even partnered with our lab. And so that on certain units, when our lab professional would come up to the unit, then we would tag in with that lab professional so they could go in, get their lab work done. The tech would be in there also. As soon as they're done, go ahead and get, vital signs, if medications need to be done, turning, any of those things that we could do all at one time, trying to be very intentional about clustering our care and even measuring, some of that. So just two ideas that you can take back to the team that help them to recognize this is not only a benefit for, the patient, but this can also benefit them as team members and let them have a voice in what that looks like. Now, how does it benefit the organization? So I think we talked about earlier that when the body is not healing as effectively as it should, then it's not necessarily cooperating with the medical protocols that are out there, which could increase a length of stay. So the benefit of this work will be decreasing that, and which can be quantified for the organization in showing how we are decreasing length of stay for patients and families. Increasing our operational efficiency, that can impact team member engagement. It can impact truly, if you do some time studies and the team see that they are able to work more effectively, efficiently, using their critical thinking and making a bigger impact on patients and families. As we talked about a little bit earlier, and maybe an opportunity to decrease some of the workplace violence. As patients are more rested, then we could possibly see a decrease in some of that edginess and irritability that could decrease some of the verbal workplace violence and improved patient experience also as we provide more times of rest. And so I would encourage you for next steps, share this video, not just with your leadership, that's important, but share it with some of your team members. Share with lab professionals, pharmacy, your nursing professionals, your techs, some of those folks who are directly and indirectly truly impacting your patient care. Next, one thing I say in every single video, co-create, co-create, co-create. Bring in a team of individuals, including patients and family members. Talk about why, not necessarily the question itself, the question is there, but why you feel like there's value in it, and what can we do to bring that value of restfulness into our organization. Explore your vital sign policies, challenge your vital sign policies, bring in your physicians, your residents, bring your physician colleagues in, let others have a voice into determining what is the appropriate vital for the appropriate patient at the appropriate time or appropriate interval. Also talk about clustering care and let the team members do some rapid cycle, study and improvements around some of the clustering and get some quick wins in order to determine what works well, what works on certain types of patients and on certain units. So I am looking forward definitely to hearing your comments below on what you and your organization are doing towards providing this environment of restfulness. Please put your comments below. I can't wait to read them and I can't wait to respond to them. ToniTime is brought to you by Landing Exceptional Experiences. At Landing Exceptional Experiences, we partner with healthcare organizations to create a culture that improves your patient experience metrics, but also improves your Leapfrog Hospital Safety Grades, truly and intentionally connecting the dots of quality, safety, and experience. There's a link below to my calendar, and I'm looking forward to connecting with you in this complimentary 30-minute conversation. As always, don't forget to like, to share, and to subscribe to this video. This has been ToniTime, where solutions are just a discussion away.